Will the COVID-19 vaccine affect my fertility?
So the short answer to that question is no. Current data and scientific studies indicate that COVID-19 vaccines, firstly, do not affect your ability to become pregnant, and secondly, are safe to receive during pregnancy. In fact, experts are recommending vaccination whether you're pregnant now or you're planning to become pregnant in the future. However, there has been a lot of misinformation circulating about vaccines and fertility, and it's one of the top concerns raised by many patients. That means we have lots to talk about, so let's get to it. So when the COVID-19 vaccines were approved, one of the first things that popped up was a false association between the spike protein on the virus and syncytin-1, which is a key protein in placenta development. The claim, which I'll say right now is completely false, suggested that training your immune system to defend against the coronavirus will ultimately cause your immune system to attack syncytin-1, thereby damaging the placenta and putting your pregnancy at risk. In reality, these two proteins have very different structures. There was never a risk that the COVID-19 vaccines would or even could have this effect. Unfortunately, this rumor and other misinformation like it has stuck around quite stubbornly, leading to a lot of people worrying about their own fertility or even their children's future fertility. But the data from studies taking place all over the world do not justify these concerns. If anything, the data can be quite reassuring. For example, Dr. Duchesne Fell and her colleagues at Bourne, Ontario, have examined data from over 40,000 pregnancies. They found no patterns of adverse pregnancy outcomes with vaccines. We also have early data from the Canadian COVID-19 Registry for Pregnant and Lactating Individuals, also called COVERED. This is a national survey on COVID-19 vaccines in pregnancy that I'm proud to lead out of the University of British Columbia alongside colleagues from across the country. Analysis is ongoing for this study, but the data so far from over 5,000 volunteers do not raise any safety concerns. In fact, shows no additional adverse events related to receiving the vaccine in pregnancy and no increase in pregnancy complications. I could certainly go on and on. There are sound studies that have been well designed and have been scrutinized by experts, and they're all contributing to a tremendous body of evidence that tells us these vaccines do not interfere with your ability to become pregnant or to carry a pregnancy to term. So let's move on now to talk about why vaccination is not only safe, but it's actually recommended for those of you who are pregnant or hoping to become pregnant. In addition to studying the vaccines in pregnancy, researchers have been looking at the impacts of COVID-19 infection on pregnancy. And I'm one of those researchers. I'm the lead for a national project studying COVID-19 in pregnancy. When the pandemic hit, we knew that we would need data to get a better understanding of what happens if someone gets sick with COVID-19 during pregnancy, what impacts it might have on the pregnancy, how those impacts might affect the baby's health outcomes, and whether the virus can be transmitted from parent to child in pregnancy or postpartum. Early in the pandemic, these were all question marks. We were talking about a new virus after all. So we launched this national project across Canada with 6 provinces sharing data so far to help us answer those questions. Similar projects are happening in other countries too, and from a data perspective, that's exactly what we need. It means we're building a deep understanding of what's happening both here in Canada and around the world. The recent data shows that basically, if you look at a group of pregnant patients who end up with a COVID-19 infection, about 7.8% will require hospitalization because of it, and 2% will be admitted to the intensive care unit. So it may be easy to look at those numbers and say they're small percentages, maybe no big deal, but you have to compare those figures to what's happening in patients who are not pregnant in order to get a sense of whether something is riskier in pregnancy or not. Based on where these figures stand now, you're actually 3 times more likely to be hospitalized if you get COVID-19 during pregnancy, and you are 6 times more likely to end up in an intensive care unit if you get COVID-19 during pregnancy. We are also seeing higher rates of preterm birth in pregnant patients with COVID-19. The rate of babies being born too early is 11% for those with COVID-19, compared to only 6.8% in those not infected. So studies are showing that if you get COVID-19 during pregnancy, The inflammation associated with fighting the virus may actually cause abnormal changes in the placenta. So while the vaccine does not lead to placenta issues, the real viral infection can cause harm. What all of this is telling us is that yes, COVID-19 during pregnancy puts you at an increased risk for these negative health outcomes. Generally, thanks to the wealth of scientific data that we now have available to us and the studies I've described, experts are actually recommending vaccination, whether you're pregnant now or if you're planning to become pregnant in the future. So this is all about making informed decisions based on real facts. So I hope that this information about COVID-19 vaccines and fertility has been helpful. Of course, if you have questions or concerns, I encourage you to talk to your healthcare provider about the options that will be best for you. Thank you and stay safe.